Okay, we're almost there. Pancreatitis. So, what's the most common cause of pancreatitis in women? Well, women get gallstones more commonly than men. We've already gone over that. So, the most common cause of pancreatitis in women would be a gallstone that leaves the gallbladder, travels down the common bile duct, and then gets stuck where the common bile duct and the pancreatic duct have already met, and now it's causing blockage of the pancreatic duct, and that is going to lead to pancreatitis. What's the most common cause in men? Alcoholism. So alcoholism is a big cause of pancreatitis. All right. Now, it's not to say that women can't get pancreatitis from alcohol, and it's not to say that men can't get pancreatitis from a gallstone pancreatitis, but just in general, these are the most common. Okay, and what happens? So the digestive enzymes aren't usually active until they get into the duodenum. But with a blockage of the pancreatic duct, they leak into the pancreas and basically auto-digest. So it auto-digests the pancreas and leading to pancreatitis. So if you get recurrent bouts of acute pancreatitis, you will be left with chronic pancreatitis and pancreatic insufficiency, meaning you won't be able to make the enzymes that are responsible for digestion in the small intestine, and that'll lead to malabsorption. Okay? So remember the three most common causes of pancreatitis. 1, alcohol. 2, gallstone pancreatitis. And 3 is hypertriglyceridemia. So elevated triglycerides in the blood can lead to pancreatitis. So the fats in the bloodstream can irritate the pancreas and lead to pancreatitis. So some people that have very terrible diets can have very high levels of triglyceride and they present with pancreatitis. Okay, so acute pancreatitis continued here. So let's go over some findings. So pancreatitis usually gives you severe epigastric, right in the pit of your stomach there, severe epigastric pain that bores right through to the back. Because the pancreas is actually quite deep in your abdomen, so you get severe abdominal and back pain. You're often nauseated and vomiting. You're not really able to eat because everything you eat hurts more because you're stimulating the pancreas to work. So the tests that we check for the enzymes that we check in the bloodstream for pancreatitis is an elevated amylase or an elevated lipase, and lipase tends to be more sensitive. The white blood cell count can be elevated in pancreatitis. Not necessarily 16,000. I mean, I can see that number there, but just an elevation of white blood cell count. There's no need to memorize a specific white blood cell count. Hypocalcemia. Well, that's kind of weird. Pancreatitis causing low calcium in the blood. So if you think of all the inflammation that's occurring in the pancreas, what happens is, so calcium is often attracted to inflammation, and you get calcium deposit within the pancreatitis, within the pancreas. So it pulls serum calcium, and it lowers the calcium in the bloodstream because it's combining with the inflammation within the pancreas. And the same thing for magnesium. It's even more important for the calcium. So you get hypocalcemia, and we actually monitor calcium level in pancreatitis. Can you get an elevated glucose? So if you have a severe pancreatitis, it will start to impact the endocrine part of the pancreas, which is insulin secretion. So the exocrine is secretion of digestive enzymes. The endocrine function is secretion of insulin into the bloodstream. So if you have a severe pancreatitis or if you have repetitive pancreatitis, you will get elevated blood sugars because you're becoming diabetic secondary to pancreatitis. Okay, so we also follow blood glucose levels with pancreatitis. Elevated liver function tests and bilirubin. Okay, well, if the bile duct or the pancreatic duct that connects to the bile duct is obstructed, well, because there's so much inflammation in the head of the pancreas, then you could get elevation of liver function tests and bilirubin. Or if the pancreatitis is caused by a gallstone, well, that's going to cause pancreatitis, as mentioned before, because the pancreatic digestive enzymes can't get out and they auto-digest the pancreas. Okay, so probably the most common way of getting elevation of liver function tests and bilirubin is the gallstone lodging deep down in the common bile duct, blocking the pancreatic duct, and causing liver AST, ALT, and bilirubin to leak into the bloodstream from the liver. So what's the management for pancreatitis? So initially, whether it's from gallstone pancreatitis or alcoholism or hypertriglyceridemia, you're typically NPO, so you're not having anything by mouth until the pain settles. So that means that you're on IV fluids and we're giving you intravenous painkillers, typically intravenous narcotics, since this is a very painful condition. And then we begin giving small, frequent, low-fat meals. And why do we give small meals? Well, less to digest, and low-fat so that the pancreas doesn't have to secrete or isn't stimulated to secrete as much lipase, which is going to make the pancreas work. Pancreatitis is linked to coffee consumption, alcohol for sure, and smoking. So to avoid those in pancreatitis is a good idea, especially the alcohol. So we manage really with IV fluids, bowel rest, nothing to eat by mouth, pain medications, and if there's sugar, and we follow their sugar and their calcium, and if their sugar is elevated, then they may need subcutaneous insulin to control their blood sugars. And then there's a slow introduction of small, frequent, low-fat meals until they're able to take oral painkillers. We usually maintain them on intravenous painkillers. Okay, so I listed the main risk factors as 1, 2, 3 here. Well, not really risk factors, causes of pancreatitis. So alcohol abuse, gallstones, and hypertriglyceridemia. 1, 2, and 3. I did mention before that a pancreatic cancer can also, if you have a pancreatic cancer that's blocking the duct, the common bile duct and the pancreatic duct, so that's usually in the head of the pancreas, the part that the duodenum wraps around, and if it blocks the common bile duct and the pancreatic duct, well, that can lead to pancreatitis, and that'll lead to a common bile duct obstruction leading to jaundice, right? Another risk factor, well, age. Age is always a risk factor for diseases. And smoking. So smoking in itself is a risk factor for pancreatitis. We mentioned that any of these can lead to release of digestive enzymes in the pancreas, causing autodigestion and destruction of pancreatic cells. Let's talk about the signs and symptoms again. I know we've mentioned it, but severe epigastric pain that bores through to the back. You can get left shoulder pain, just like you can get right shoulder pain in the setting of cholecystitis or biliary colic. You can get left shoulder pain as radiation. And the pain is definitely worse when you're lying down. You can just think of it as this pancreas, which is really deep in the abdomen, close to the spine and the back. When you lie down, all that inflammation is now leaning against the back wall of your abdomen, giving more pain. Okay, so worse with being supine. Nausea, vomiting, and aggravated by meals. So when you have a meal, you're forcing the pancreas to release digestive enzymes to digest them, and that's the last thing you want to do to the pancreas. You want to rest the pancreas. So I won't spend too much time on the first part of the slide since I just mentioned it. Aggravated by eating. This would not be relieved by vomiting at all. You will be vomiting with it, but it won't relieve the pain. And just in terms of the severe, deep, piercing epigastric pain radiating to the back. Okay, so the other symptoms I've mentioned: the nausea, vomiting, low-grade fever, leukocytosis is elevated white blood cell count, and if the pancreatitis is bad, I mean, people can easily die of this because there's so much inflammation and there's so much fluid surrounding and rushing to the area due to the inflammation that you can become hypotensive with massive fluid shifts in and around the pancreas. You can be tachycardic because you're hypotensive, jaundiced because you're now so inflamed that you're blocking the common bile duct. Absent bowel sounds. So remember paralytic ileus, where if you have a severe illness, the bowel will actually shut down peristalsis. So that can happen in pancreatitis. There's two signs that are not a bad idea to remember are related to pancreatitis. So Cullen's sign. So basically the pancreas, as it gets more and more inflamed, it actually starts to bleed because of all the inflammation and the rupturing of blood vessels. And the bleeding it can leave the pancreatic area and appear more on the superficial tissue, which is a bad sign in itself because it's telling you have hemorrhagic pancreatitis. So Cullen's sign is where you see bluish bruising around your belly button, the umbilicus, and Gray-Turner's sign is where you see bruising along the flanks of your abdomen. Both signs of hemorrhagic pancreatitis. Not a good thing. Okay, another question here. What lab results could indicate severe pancreatitis? Well, or any pancreatitis, right? So if someone has acute pancreatitis, which is really a painful, miserable pain, it's usually a boring pain from the epigastric area, so the upper abdomen, and it bores right through to the back. Okay, so very painful, often associated with nausea, vomiting. They can't tolerate any food. And let's just remember what the pancreas does. So the pancreas has two functions. It has an endocrine function, where it produces insulin, and also another hormone called glucagon. And it has its exocrine function, where it secretes digestive enzymes into the gastrointestinal tract. Okay, what if you have massive inflammation
of the pancreas, either from alcohol, say there's a gallstone blocked in one of the ducts of the pancreas, that'll cause pancreatitis. Or another condition that can cause pancreatitis is high triglycerides in the bloodstream. Okay, so let's just say a patient has one of those. Let's choose alcohol, since that's a pretty common cause of pancreatitis. Well, there's going to be a lot of inflammation. That's going to lead to release of digestive enzymes around the pancreas, leading to autodigestion of the pancreas, which will of course cause severe pain, but it's also going to release those enzymes into the bloodstream. So enzymes such as amylase and lipase will be released into the bloodstream. So we would definitely expect an increase in either amylase or lipase in the bloodstream. What else can happen with severe pancreatitis? Well, if it's severe pancreatitis, the pancreas may not be producing insulin, right? And if you don't produce insulin, you get elevated blood sugars, right? Diabetes. So let's look at the answers. Decreased serum amylase? No, right? In pancreatitis, you should have an increased serum amylase. Increased serum lipase? Absolutely. Lipase is another enzyme from the pancreas. It would be increased in the blood with pancreatitis. Increased serum calcium? No. In actual fact, in pancreatitis, you have low calcium when it's a severe pancreatitis. And why is that? Well, there's so much inflammation that calcium is being attracted to the area, and it's binding with a lot of inflammatory sites in the pancreas. So later on, we can actually see that there's calcifications forming within the pancreas. So if you can think of it, intense inflammation, calcium is attracted to the area from the bloodstream, and it lowers serum calcium. Okay, so remember that for pancreatitis. Okay, because those are electrolytes that you should understand with pancreatitis. That the serum calcium goes down because there's leakage of calcium from the bloodstream to the inflamed area. Lastly, increased serum glucose? Yes, because you could have reduced insulin production. So the answers here would be increased serum lipase and increased serum glucose.
Okay, so here's Cullen's sign, which is really the pancreas is so inflamed that there's blood surrounding it now, and the blood tracks from the back of the abdomen to the front and starts to show abdominal bruising because there's so much blood in the back surrounding the pancreas. And here's Gray-Turner's sign of a hemorrhagic pancreatitis. You can actually see a Cullen sign on here too if you look to the front of the abdomen. So this one has Gray-Turner's and Cullen's, and this is related to hemorrhagic pancreatitis. Okay, I think that's the end of this module. If there's any questions, you can email me and I will answer them. We can have a review of this module or any other modules if you ask Shani or Lacey. I'm happy to do whatever. And we've stuck to 2 hours and 21 minutes for this module, which is what I'm trying to average per week. Okay, bye-bye.